Thanks for tuning in, folks. I'm Santosh Mohan. I serve as the Vice President of Digital Innovation at Center for Digital Health in the Moffitt Cancer Center. Truly an honor to be representing Moffitt and CancerX at the ASCO National Conference in Chicago. We have a very special guest with us today, the brilliant Stefan Konya.
Oh, yeah. Okay.
Stefan's the Senior Advisor and Innovation Portfolio Lead at the Office of the National Coordinator for Health IT. CancerX was launched just a few months ago. It is a White House-backed initiative to boost innovation in the fight against cancer. CancerX is co-hosted by Moffitt Cancer Center and the Digital Medicine Society, alongside our partners in the federal government, the ONC and the OASH. Stefan here is the CancerX lead from the federal government. Stefan, it's an honor to have you joining us. You've been a fantastic collaborator for Moffitt all along, right from the early days when we were shaping CancerX as a startup accelerator that is oncology focused and consortium driven to where it is today. Part of the Cancer Moonshot, a national initiative that is convening the diverse stakeholders from across the nation to really unleash innovation to create a future that is free of the burden of cancer. Tell us in your words what CancerX means to you.
Wow. Well, Santosh, it's great to be with you again. I've known you for many years, and certainly looking forward to this amazing opportunity to continue working with you in this new capacity. For me, this isn't my first rodeo as far as national public-private partnerships for innovation acceleration go. I got to work on KidneyX, I got to work on LymeX, PandemicX, which is a one-year accelerator, and now I'm extremely honored that we were finally able, with the White House's blessing, to be able to move forward on CancerX, something that I think is honestly probably going to be one of the most monumental things that I do in my entire career. For me, what it means is really an opportunity finally to bring together all the amazing innovators we have in this country and in this world who want to try to bring new innovations to market when it comes to the oncology field, whether they're to help patients or to help caretakers and providers who in giving those treatments and setting up the coordination of that care. Finally having a platform where they can all come together, a safe space where they can collaborate together is something that's truly unique. And it's because of the timing. We're lucky that we have a president in the White House right now who has reignited the moonshot just last year. And then as part of this reignition of the moonshot, had this commitment to really bringing the entire industry together to collaborate under one big tent, under one big umbrella. So we've had, Moffitt and many other institutions have been doing, trailblazing innovation over the years and decades. But I think this is new. This is like a first time where really we've had them all collaborating. MD Anderson, Dana-Farber, the list goes on and on and on. So many different cancer centers, but also we've got at the table patient organizations, patient advocacy organizations, community-based organizations, societies, biotech and pharma, right? And of course, government. Right, so it's a chance for us, not just ONC and the White House, but National Cancer Institute, which has always been an amazing advocate and working closely with organizations like yours. But we're also bringing in the VA, Indian Health Service, FDA, all these other agencies now have a singular umbrella that they can collaborate under to help support all this innovation.
Yeah, I know some of our work is already underway, focusing on addressing financial toxicity in cancer, and so that's a source of great enthusiasm. But we certainly look forward to the accelerator that we're going to be launching, as well as demonstration projects at Moffitt and at many of our member sites. Stefan, you mentioned patients, and this year's theme at ASCO is all about partnering with patients. Tell us how you think CancerX will accomplish that.
Well, again, it's an amazing call to action, and for this conference to be focused around the patient, rightfully so, it should be. That's what we're all in this for, right? It's for the patients. We're all patients ourselves at some point, and cancer has touched many of our families, right? So we know whether we were the patient or a member of our family has been the patient, we want to make sure that we're focusing all this innovation to ultimately meet their needs, all right? And in this difficult time of having a cancer diagnosis, going through the treatment, that we're trying to ease the burden of that as much as we can, as much as possible. So as far as actual patients being able to get involved in CancerX, again, it's a big tent. All are welcome. We think there's a lot of different ways they can get engaged. We've got a three-pronged approach for CancerX, as you know. The first project is solely focused around financial toxicity and health equity and dealing with families and the patients going through that experience of a cancer diagnosis. So figuring out what does it need to look like, what kinds of tools can we develop to help them on that journey. And it's all about the patient, and we've got their voice included in that. The accelerator piece, we want to have as part of the accelerator to work with startups, a patient panel, others who could participate in providing their experiences, their real life stories. Through the Cancer Moonshot website, if you haven't been to the website, I highly encourage you to Google and look it up, White House Cancer Moonshot. There's a chance for any patient and their family member to give their own testimonial as to what the experience is like going through a cancer diagnosis and treatment. And so, that's something that we want to encourage more people to do, because we collect that feedback and we then factor that into ultimately the innovations that we're trying to develop and making sure it's being responsive to their needs. And then lastly, there's a demonstration project, so we want patients to actually be part of that as well. So at every step along the way, we want to make sure that patients are not only in consideration, but actually at the table helping shape this.
Yeah, thank you. At Moffitt, I can say that it's really the courage of our patients that inspires us to bring hope to every patient we serve and bring them some of the best outcomes, 4 times the national average. So looking forward to doing that and accelerating it with CancerX in partnership with you, Stefan. Thanks for tuning in.